Here's a perfect place for shoulder stuff. One thing too, great place for some of the neck stuff. I can just ask the client, lift your head up off the pillow as far as you can, comfortably bringing your ear to your shoulder. Good, down, cool. If I remove the pillow, and I say, okay, hold your head up for me, and then slowly let your head down. Let's just confirm you can get all the way down to the table comfortably. That okay? Okay, good. Lift back up nice and slow. Active movement's always going to be safer than passive movement, especially at the neck. That's one thing I'll always tell you to defer to. Have them do the action for you. And then here, you could even have them do the rotations. Go ahead and turn your head. One way. Yep. Good. And relax. Now, like anything, comparing and contrasting would be easier. For specific neck stuff, I usually do that more on supine because I can compare one side to the other real quick. But this one I can even have a person go into hyperextension, like look up for me, tilt your head back, go forward. So saying if somebody's limited to sideline, you can still pull off all these neck related assessments, and it's certainly better than doing it in prone. so at the very least, hey, sideline and supine, that's where you do the neck stuff. Okay? And then Andrew was already at the shoulder. Here's where you can do all the cool shoulder stuff. But let's start with scapula. Let's think scapula first. What I have to do then is make sure that I am stabilizing and grabbing a hold of it. Let's see if I'm floating around. That's okay. You want to make sure that your hands are stabilizing what's called the acromion process on one side. So when I reach over to the front like this, I'm making sure my fingers are on top of the shoulder on that little shelf, right? So I want to be there. Now, you can be kind of relaxed wherever. Now this hand can be wherever. It can be right on the scapula. It could be just below it. Let's start with it kind of right on it. But then just generally, let's try to think about all these scapular motions. Elevation and depression. Elevation and depression. So just shoulder up, shoulder down. Elevation, depression. Cool. Then we could play with protraction and retraction. Those are easier. Upward rotation, downward rotation would be a touch tougher here, but we'll play with once we get the arm at range. But now think how you could the way I do the rotation stuff is I get my palm down on the inferior angle of the scapula, and then I can kind of nudge things back and forth that way. So if I push the inferior angle down, I'm doing this. And if I pull it up, I'm doing this. So I can either pull on it, by using that claw, getting to the edge of the scapula and just trying to pull that lower part of it up towards me. And you kind of visualize how if I do that, I'd be doing this to it. And then if I push it down with my palm, then I'm doing this to it. And you can sprinkle this in a way that you can make it feel pretty good. That's not too pokey. Okay, good. Making sure my fingertips. I felt a small twitch and I wasn't sure if it was just inadvertent or not. But all of this, you can see how you could turn this into something relatively rhythmic and enjoyable. And if these fingers here, for example, were to come up and be a little more an upper trap, maybe choose to be on that spot that most people want you to massage more. I can kind of sprinkle in what feels a little bit like I'm working an upper trap, but I'm also getting all the scapular mobility stuff. It's real gentle. It's not taking anything to end range. And I can, look at this, I can kind of play with even the ball and socket joint, kind of roll it around, internal rotation, external, and then this, external, internal. So lots of cool stuff. At the very least, you can use this as something that feels good, and you could be thinking, just can I get the scapula moving, right? Comparing one side to the other. How does this one feel compared to when we work on the other one? And you'll get better identifying. This is easy, elevation, depression. Then roll in a circle, and then it can work really good to just use your fingers to kind of do a little bit of a pull. And that's either doing some protraction, retraction, or it's doing some upward rotation, downward rotation. But the scapula needs to move in all those directions. Now, where it usually gets tight though, as you've certainly seen with me, is here. So it's a perfect place to kind of reinforce where we want our arm to be placed. I want it to be lateral, anterior to the scapula. I put my forearm here. I don't need a ton of pressure because the muscle mass isn't big, but I want to not be on the scapula. Usually the scapula is too much this way in protraction. If I want to help a person get back into retraction, I bring the whole shoulder girdle towards me, and I'm going to plant my forearm, and that compression is going to naturally push the scapula a bit back into retraction. So I'm going to be shifting the scapula to a place it more ideally should be, and I'm going to get the compression on serratus anterior and latissimus dorsi all at once. So good squash. Make sure with your client you're not too much on the scapula. You really want your forearm to feel like you're more on the ribs than you are on the scapula. To make it more comfortable, you can let the arm just lay down right on top of yours. It can even fully lay down. Go ahead and relax your arm. You can completely let that arm lay down, and you can bring your other hand over onto the acromion process above, and then we could just roll that scapula around. Right? I mean, it works great. And you're getting two muscles, you're affecting two muscles, latissimus dorsi, serratus anterior. Latissimus dorsi is going to be a bit more posterior. Serratus is going to be right on the ribs. But we just roll this around. We don't have to turn this into a glide. We do not need to be trying to glide across the ribs. This ends up being what I think feels better and is far more approachable for you because it feels like you're not just grinding on the ribs. And you could do this over the sheet. So, big win. Now, we're right here in position for all the shoulder mobility stuff. Rule of thumb. Okay? Well, that's amazing. Look at that. That's what I would want. I would want to feel like there's comfort, a little bit limitation over here. But look, I can get it right to the head. No issues with the ball and socket joint. Okay, then rule of thumb. Excellent. And she's better that way a little bit compared to abduction, right? So then that helps identify. So that was freer for him. This was end range into abduction. Okay, obviously hyperextension, but all this just kind of can quickly occur in the midst of just doing these motions. I just roll the shoulder on in a few ranges, okay, cool. Make this a dance. Supporting the arm, guiding it, cool. And then I can all get coupled as part of me just getting their arm into position, and it sprinkles and it phases right into the massage part. And we're good to go. Now, if there was restriction, maybe, what I would always suggest with this, with shoulder stuff, rather than taking it to full on end range like this, and be oh yeah, well let's get more, right? She doesn't need more. I would find this and be I don't need to be doing any kind of aggressive muscle energy technique stuff here. Unless maybe there's some weird symptom going on. And if there were symptoms here and I saw this kind of range, I'd be there's hypermobility. Pin and stretch ends up being one of the more effective things we can do. So I can know that this would be the action for the stretch, right? So if I make it shorter first, then pin the stuff, then do the movement, I'll be able to find a stretch for her without having to take that shoulder to end range. There should be the beginnings of a stretch. Is that correct? Mm-hmm. Good compliance by client. Now they could actively do it for me if I was more concerned. I'd say, okay, feel this action. I tend to show people the action, but this is the action we're looking for. I'm gonna compress right here, and then I want you to reach up over your head and find the stretch, and stop right when it starts to feel like we're getting the stretch. I'm supporting the arm so I could catch her, but she's doing all the work. Good, come back down. If I wanted to go even further with this, I'd say, go ahead and push your arm right down into me. Squash my arm between you. Okay, good. And then reach. That'd be contract, relax, antagonist contract. With the benefit of getting what you kind of call an active pin and stretch. So this technique right here, if I passively do it, okay? If I shorten the tissue, compress the tissue, and then I passively move the joint to a stretch, that's called pin and stretch. See, I shorten it, I pin it, I stretch it. That's pin and stretch. You can do that everywhere. If I have them actively do it, shorten it, pin it, then you actively lengthen it, so look for that stretch. That is active release technique. That is just active pin and stretch. That's all it is. The active movement stuff will usually be safer, it will be more effective, because you're getting their nervous system involved, and they're going to default to not moving into a range that's dangerous. But it's not as relaxing. So, if you're going to do pin and stretch, then be careful and don't force through end ranges. But if you really want the therapy piece of things, then that becomes one of your big tools. Identify what's short, compress it, have them actively move it, and let them even just find. You tell them, where I'm pushing, I want you to find a motion that feels like we're lengthening and stretching that. And then they'll discover it. And you just be there to catch them and support them. Cool. See some methods of the madness starting to make sense? So, all right, hip stuff. This top leg is already doing a lot for us assessment-wise. I can even take the bolster and move the bolster. If I needed to assess, can they get to further flexion? It's not my preferred thing to do necessarily, but I could just move the bolster to make the hip more flexed. It's not the most graceful thing in the world, but it works. Now, if I remove the bolster, then that hip is going to drop down, and I can see how good is she able to get into horizontal adduction. And I may also get to observe some internal rotation of the hip, but I'm not going to see that as much here. Some rotation of the lumbar spine. Rotation of the hip in this position, I want you to distinguish the difference between horizontal adduction. So if I'm like this and I do this, I've just adducted, horizontally adducted my hip. Just like with the shoulder, it's horizontal adduction, okay? This would be rotation. I support the knee, and then I'm going to use where I'm holding at the ankle. If I lift that part, that's internal rotation, right? If I drop and lower my hand, keeping the knee stable, then that's external rotation. Now this is all okay, but we'll find this is much easier to do in supine. But I could do it here in this position. Lift your leg up for me. Good. Okay. Knee flexions, extensions. Look at our ability to do ankle assessment though in this position, right? I'm able to really test dorsiflexion, plantar flexion, and I can couple that in a way that feels like more like massage. Inversion, eversion, plantar flexion, dorsiflexion. Toe extensions, toe flexion.
I know.
Pants and stuff or shoes. You can take shoes off too if you want. You want shoes up?
Sure.
Doesn't matter. You comfy?
I wasn't sure about it at first.
Doing good. Hey, perfect. So, here at that top leg, and I flip this a little bit. So just to make it more like your massage routine, let's go over to the other leg real quick. I don't usually remove the bolster and use that as too much of an assessment. Person turns on their side, then that will give me the information. Then I slot the bolster in, and that'll kind of tell me, like, look, their hips able to or able not to do that. So, all right. The bottom leg, though, this is the place where we can do more of the hip hyperextension work. So all I have to do is bring that leg further back. Have to be aware with draping. Now you're gonna have clothing causing restriction right now. So we're not just gonna force through any kind of restriction, okay? But if I bend the knee and I confirm with the client, like, okay, we're gonna bring the hip back, make sure you let me know it's not causing any kind of strain in your low back.
Okay.
But I can just, right here, yeah, I usually do one or two things. I'm here,
This side, yeah.
and I can stabilize and I can go further. I don't do a lot of stretching, but you could, yeah, you could keep going. And this is
It's a little bit better.
if the hip flexors are tight, this can be pretty good. And you can change the thing to pick if you're looking to do a stretch like this, is how much of a knee angle are you using? You could let the knee be more straight and just move the femur and hip back. Or you could increase the angle at the knee and move it back. The question for you is going to be which one feels like is doing the job more. If you bend the knee more, it's going to be probably feel like it's stretching the anterior knee more. Not one of my favorite things. If I was going to do stuff like that, it tended to be in supine again, but it's an option. Okay? Knee flexion and extension, how easy is that? Thing to be aware of here is if a person's turned in such a way where they're kind of rolled over at the pelvis and you see their leg resting like that, right? We don't want that. We'd want them to turn enough to where their leg, the side of their leg is actually resting on the table. That way when we're doing massage, we're not gonna create any stress on the knee, right? Okay, easy peasy. Ankle stuff again. That's one of the nice things about sidling. A person can like reorient their leg in such a way where they're more comfortable. And you want to see that though. Ideally, lateral side of the leg, lateral side of the foot resting on the table. But here again, we're in a great spot for all the ankle mobility stuff. Dorsiflexion, plantar flexion, inversion, eversion. And then metatarsals, I do better moving them on this one. Where you can couple this in really good and just be thinking now as you're doing massage techniques relative to like soft tissue, what are you also doing to the joint? Then with this one, I don't tend to do a lot of repositioning of this top leg. Oh, okay. Can always look at rotation here too. The table's gonna get in your way, of course, but you can at least see how good they're doing in external rotation. Supine, better for that stuff. But here, that ankle, we already talked, dorsiflexion, plantar flexion, inversion, eversion. But those metatarsals are what allow for the adduction of the toes. So if I work my way through and I'm making sure I move, so there's the pinky toe, find the pinky toe, then the long bone that goes into the foot. So that's going to be the fifth metatarsal. I don't move them like this with my fingertips. I grab like this. So how's that metatarsal doing? Then I move down. How's the fourth metatarsal doing? And then my bottom hand will start taking over. And I'll be, how's the third doing? How's the second doing? How's the first doing? It ends up looking like I'm just bending a foot back and forth. I'm just not doing it mindlessly. Okay. And then standing right there to take the bolster, and we'll flip you on the other side. We can kind of just skip the neck part. We're gonna go right to the scapula part. This is where usually I start the massage here, right? Head, neck, little bit of like stuff related to the scapula or shoulder, and I'll be coming around and then getting a hold of that arm. and going into this range of motion stuff. And then just ideally you're in a position where you could compare and contrast. I try to set up these routines where you're doing as much of like working on one side in a timely manner to the next side, so you can kind of remember how it feels. But I mean, it's tough after you turn person on their side, do this, work on the legs, turn them over, you know. There's a roll, elevation, depression. Just kind of get comfortable with how you can, with as good a body mechanics as possible, accomplish these actions. Feet flat, stay on your heels, and then get some reinforcement for your client. Like, pick a couple options and ask them which one of these feels better. I'm gonna go ahead and ask you, like, does this feel better to do? Or does it feel better when I'm moving the scapula?
Moving the scapula.
Yeah.
So feel better to do
So,
elevation, depression, or maybe rotate forward.
then you'll feel my palm. I have it
I think
kind
for
of
me,
aimed like
the
this.
rotation
So this side of my
Yeah.
palm is acting like a wedge.
Pull it away
just
from the
kinda
spine is when
give
it
it some
feels
oomph.
good.
Protraction.
Yeah,
You see, I can start real low and go all the way basically into the armpit.
giving it some space.
And then I can also do like a little movement
Or
like that.
there's curling the fingers and then using
That's getting at some stuck
this.
tissue.
So protract.
I don't do too much of that, and like you have plenty, like I can, there's space here. So all this would show that there's nothing really
Little traps.
Yeah.
too bad going on.
Without
I'm trying to remember where your symptoms show up. If you have stuff, what you tend to get.
Usually
I
lower
mean,
back, but
You're fine.
It feels like a stretch and
Everybody
I
gets
feel
some of
like I
that.
need that.
But
It just
the
doesn't
low back
feel
thing would
right
make more
to me.
sense to me when I saw
I
the
know.
rotation stuff. Yep. So like
It's
right
a
there,
good
If this was
Is
like
that a thing?
overall, this
I know.
was the
so I can
best.
kind of get my hands
Along
set,
with the protraction.
really
The
back,
protraction is probably
all that.
best.
I spend more time just doing this.
Cause I have a feeling you're able to get.
Because I can massage that stuff and probably just fine, right? So why tire my hand out?
right, yeah.
Okay.
I mean, that's what I would want.
Yeah.
That's a good marker to work off of. You give what you like. So, all right. Then very good. Going into the shoulder mobility stuff. Rule of thumb.
Shoulder mobility.
Good. Thumb.
Reduction.
Good. Cool. Then to couple some massage parts, we're able to do that pin and stretchy kind of quality. Shorten the area. And a forearm. And then I tell you, this one's so easy, you might as well usually defer to just having the client do it. It's like, okay, go ahead and reach up over your head nice and slow, look for a nice stretch.
Hyper extension.
That's not incredibly labor intensive.
Quite a
It's
bit.
not gonna hurt anybody or be that unrelaxing to do. Go back down. Okay, good. Search for the stretch again. Not too ribby, right? Okay, hold, big deep breath.
Maybe use more of
Out.
the thicker part of your
Okay.
forearm there,
Thicker part.
Down.
or less pressure.
One more, big deep
Okay.
breath. And then reach with the
Better
exhale,
there.
find that stretch.
Mm.
So you can couple breathing stuff with any of this too.
A little bit.
Good. And then with that, if we wanted a more passive way to pull off something similar, it's just resting the arm down. For those of you that this works for, you can try my technique of you just let your wrist come up. This is the one time where that would be okay. You put their wrist right on your thumb pad, and relax your arm. And then I can do that whole. And then
Right.
right here, can always just confirm hip to extension, hip to hyperextension if I needed to. Knee flexion, knee extension. Great. This is a perfect place where I include usually. Depends a little bit on how things are going, but like she's like the perfect height for this to work out where I can, even if the foot's resting on the table, like I could shorten it, shorten everything by just picking the foot up like this, apply pressure, and let the foot come down. And it's not gonna be anything overly aggressive, but like with some lotion, I could be doing this little sneaky joint movement action that could be inversion, eversion, or it could be dorsiflexion, plantar flexion. And I kind of just couple it all together. It'll feel like I'm more, as long as the ankle feels healthy and there's no hard end feel, I'll pretty much just be rolling the ankle around in a circle while I'm massaging the posterior lower leg, so the calves. Body mechanics, always focused on what my push hand is doing. So my right heel is down, my left leg is forward, my right arm is forward and everything straight. And then my right hand can just change the shape of the ankle a little bit. That's how I could sprinkle in pretty much, which is just a bunch of joint movement with massage, but it'll feel like a lot more is happening. And knee up real quick. So we'd always want Robin slippers. Okay, no worries. Smart to really say something before. Never as comfortably to just be holding, so. All right, now I could do a similar thing on this ankle. So why not, I could do like what feels more like massage. Or grab a hold of that, be holding here, and then do it. This can be a pretty static compression to start. Now I'm stabilizing the whole lower leg, and then this hand just comes over, I'm like, all right, how's this doing? All right, not too bad. Eversion, inversion. And then similar to what I was doing with the other leg and foot, I can just be doing massage while incorporating a little bit of joint movement. The easiest one for me tends to be this. I just rest my hand on the edge, the lateral side and anterior side of the foot. And then as I do a compression, I'm just moving all together like this. And as my hand moves forward, I'm gonna take that foot into inversion a little bit. And that's gonna lengthen, guess what? The muscles that do eversion, so it turns into this real rhythmic, nice pin and stretch.
That's getting a lot.
And it just, but
It's getting a
now
lot.
comes the time where you make sure you're not forgetting this. Most important part is just keeping your biomechanics set. This is now my left heel down, right leg bent forward, right arm, and then I'm just letting this other hand come over, not twisting me, and coupling that all together. And at the very least, it's extra contact in a sensory motor like nexus area where I'm getting sensitization and massage of the foot while working here. So even from just a sensory standpoint, what a win, but we're also doing kind of these little minor rhythmic pin and stretches the whole time.
So do you incorporate all of these like assessments in every massage?
They've turned into everything I'm showing right now, like this is embedded into, right here is my personal position for how I work on the anterior chunk of what we call the shin muscles. So tibialis anterior, extensor detritus, extensor hallucis, that's more anterior. So my arm's like this, but it's easier. So now I'm thinking about this. So all I do is I stabilize them so they don't slip out of my way. And then I'm doing massage like this. And I'm getting a little bit of sneaky plantar flexion, dorsiflexion. I assess it more specifically, like maybe in prone or supine or whatever, but this is where I can just incorporate that little bit of extra joint movement while doing massage. And then I switch gears, I go from that, just hugging their heel, resting their toes on my forearm. I'll switch from that, which is working on the anterior compartment, Then my hand's on the lateral side of the foot, forearm's on the lateral side of the lower leg to work on that lateral compartment. And it's just a great 2-for-1. We get to lymph drain. This is following exactly the pattern. It's not as light as traditional lymph drain would be, but it's following the exact pattern of starting at the knee and working down towards the ankle, starting at the knee, working down towards the ankle, but I'm pumping the lymph nodes and stuff at the ankle joint. It's gonna help encourage that fluid movement much better. So it's one where I just use it all the time. There's this way to do it too, where I just grab the bottom of the foot and go like that. Now, if it ever starts disrupting the quality of your body mechanics, slow down, do just one, and then the other. It's not that big of a deal to switch, but these are kind of the tips and tricks of how to maybe do 2 things at once without it being too bad in your body mechanics. Right. Then with the foot, remembering this is just one where thinking from an anatomical standpoint, we have what we call the ankle joint, which is really made up of the fibula and the tibia, those bony knobs you're feeling. That's the lateral malleolus, medial malleolus. They sit on top of talus, it sits on top of calcaneus, and you have all the small, like square and round bones called the tarsal bones. Then you have those long bones in the foot called the metatarsals. Then you have the phalanges, the actual digits, right? So big toe is first, pinky toe is 5th, and then we're just working our way through, and we don't have to be incredibly precise, but mindfulness, you know, hey, it's magic, right? So rolling that around, hoping that that 5th metatarsal rolls well. That's why I personally don't worry too much about working on individual toes, because I'm good about making sure I work on the individual metatarsals, those structures in between them, and then I'll grab all the little toes as one. Roll them into flexion. This one I worry more about flexion. This foot, I'll worry more about extension. If I do one side and the other, then the big toe, this one I can grab a hold of and move back and forth real good. All right, once you balance that out, supine.